Crystal Cherico, registered nurse. The Zika virus is a virus that's transmitted by a daytime biting mosquito. It's in a family of viruses that can cause an array of symptoms. Most of the time Zika causes things like high fever, some joint pain, flu-like symptoms. The reason it has garnered such national attention is because of the link to a birth defect for pregnant women. They're basically the same. Of course, kids can get a lot sicker than adults can just based on their body size and how they react to things, but symptoms are generally the same. Its primary transmission route is through a mosquito bite. So you're bit by an infected mosquito, and it takes a few days for the symptoms to appear, and that virus will stay in your blood for about 5 to 7 days. It is also able to be transmitted through sex and blood transfusions, but those are much more rare. For women, no, it's only in the bloodstream for 5 to 7 days. For men, it can last a little bit longer in the genitourinary tract. It can last for 3 months, they know of, and there's continuing studies as to how long it can actually last. If you are a pregnant traveler, we always advise non-travel to Zika-infected areas. If you're just normal traveler, we're going to tell you you need to take insect precautions. That means covering up as much of your body as possible with clothing. They sell insect repellent clothing, which is a good idea. We also want you to cover any exposed body areas with an insect repellent that is proven to help ward off the mosquitoes that carry these diseases. There's not a vaccine for Zika. It's symptomatic support. A lot of people just get mild flu-like symptoms. They take some sort of anti-inflammatory or something for fever at home, and that's the end of it. People who are more severe, get dehydrated, have problems like that, will sometimes end up in the hospital, but that's not overly common. The product that was #1 was the Sawyer's branded Fisherman's Formula. It is a picaridin-based insect repellent versus your DEET or lemongrass or anything like that. The picaridin is proven to help ward off mosquitoes for 8 hours at a 20% concentration, and it doesn't have a bad smell the way DEET can. It's considered to be a little bit easier on the skin. Most of the time it comes in a spray formula. And it's great just not to have that high odor smell that you get from your regular DEET products. We always tell our travelers 6 to 8 hours, but if you shower, swim, or sweat profusely, you do need to reapply. All insect repellents, we generally start at 6 months and older, and it's safe to use in pregnancy. Before 6 months, we just tell people to practice strict insect precautions for the infants. Just make sure you're wearing your insect repellent, practice good insect precautions.